Hello everyone, my name is Sam, I'm a GP. Today I'm going to present on a topic called causes of ear pain. Ear pain is a very common presentation to general practice. Whether it is young children, young adolescent, young adult, middle-age, or in senior population, ear pain is perhaps one of the most common presentation to general practice. So it is very important that we have a very strong idea of common and uncommon causes of ear pain so that we can actively look for them. Before I begin, I want to take this opportunity to revise the principle of history taking. Number one, we must know our general anatomy very well. Number two, we must be able to identify the underlying structure or organ at the location of the presenting symptom. Number three, we must be able to identify the surrounding or related organs. Number four, we must be able to think about the different pathological process that can affect the organ or structure. The mnemonic that I use is INTOMED DDDD. And number five, the key history features from the patient to identify the most likely cause of the presenting complaint. So here is what INTOMED DDDD stands for. Let's look at the anatomy of the ear. The ear is made up of three parts. First, we have got the external ear. Major features of the external ears include the external acoustic meatus, which is here, the auricle, which is here, the external auditory meatus, which is here, the eardrum, which is here, which is also called the tympanic membrane. Next, we have got the middle ear. The middle ear is made up of three bones called the ossicles. They are known as the malleus, the incus, and the stapes. And these three bones are involved in the transmission of sounds. Next, we have got the inner ear. The inner ear is made up of the semicircular canals, which are involved in balance and positioning, the vestibule and the cochlea, which are also involved in the transmission of sound. And we also have got the auditory nerve as well as the eustachian tube, which is the connection between the nasal-oral cavity with the ear. And externally, we have got the mastoid process, which is behind the ear, and the temporomandibular joint, which is just below and to the front of the ear. So here is a table of common and uncommon causes of ear pain. In the first row, we have got common causes, which looks at local and surrounding structures. First, we have got infective cause. Infective cause include otitis media, which is infection of the middle ear. It can be viral or bacterial, and perhaps one of the most common cause of ear pain. Next, we have got otitis externa, which is also known as swimmer's ear. In this condition, water goes into the ear canal, providing a moist, warm environment for bacteria and fungus to grow. We also have to think about referred pain from the neck and throat to the ear. Dental infection, either of the gum or of the tooth, can also be referred to the ear as well. Common traumatic causes include unerupted wisdom tooth, barial trauma from deep sea diving, temporal mandibular joint arthralgia from biting too strongly or forcefully, or from an external force such as a punch. Obstructive causes include eustachian tube dysfunction, which is the inflammation and obstruction of this tube here. This leads to impaired air pressure within the eustachian tube as well as the ear cavity, causing increased air pressure, therefore ear pain. Foreign bodies in the ear as well as hard wax has also been known to be very common cause of ear pain in susceptible individuals. And finally, we have got facial neuralgias, which is hypersensitivity of the nerve due to either inflammation or toxicity, which can cause pain that is referred to the ear. Example include glossopharyngeal neuralgia. The next row shows less common but potentially serious causes of ear pain. These include necrotizing otitis externa, which is a severe form of external ear infection. acute mastoiditis, which is inflammation and infection of the mastoid cavity, herpes zoster infection, known as Ramsay-Hunt syndrome, which essentially is shingle or reactivation of chickenpox on the 7th or facial nerve, causing ear pain. Neoplastic causes or non-neoplastic causes include neoplasia of the external ear, which is cancer of the external ear, cancer of the other side, such as the throat or the tongue, which can also refer the pain to the ear. In a condition called cholesteatoma, there is a non-cancerous growth just within the mid-ear area, either due to repeated otitis media or mid-ear infection, or it can be congenital. Thank you very much for taking the time to watch my presentation. If you like the way that I present my information, please kindly subscribe. Thank you. And this is my disclaimer. Thank you again. Take care. Bye-bye. Have a nice day.